I just want to be clear in terms of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
The Bay Area's largest county, which had the first COVID-19 death in the nation, is now reporting a drop in its COVID-19 death toll by nearly a quarter, from roughly 2,200 down to 1,696.
I think transparent communication is an upside. A downside of that could be that people said, well, it wasn't as serious as you said.
Santa Clara County health leaders explained today they refined their approach in reporting COVID-19 deaths to get a better understanding of the virus, reviewing each fatality and only counting those whose cause of death was directly from COVID, and not those who tested positive for the virus when they died but didn't die because of it.
And in the midst of everything COVID, people were sort of putting down that cause of death as COVID. It is important to go back and do this accounting to see if COVID was actually the cause of death.
Dr. Monica Gandhi believes the new lower numbers may actually encourage people to get vaccinated.
Because a lot of people have kind of said, what? I've heard people are dying anyway of COVID. What's the point? And it is very important to say, no, did they die of COVID or were they in the hospital for something else? And they died of that. And that helps people say, oh, the risk of breakthrough infection is so low, I want to go ahead and get vaccinated. So I think it's very good for vaccine hesitancy.
Yeah, Maria, I'm guessing, a 22% drop in the actual deaths that the county is reporting now. That's significant. Alameda County's numbers dropping by about a quarter, I understand. So they did the same review of their COVID deaths. Do you have a sense that other counties are going to follow suit?
Yeah, I actually asked Dr. Gandhi that question, and she actually says that she believes that the CDC is actually going to ask all counties nationwide to follow what Alameda and Santa Clara counties did, and she believes that if they do, we could actually see a drop in the death toll nationwide as well. Ken?
Maria Medina reporting live for us from San Jose. Thank you, Maria.
So here's an interesting story. For 2 years, we've talked about the numbers. What are the numbers? Turns out we don't really know what the numbers are because there's too much lying about the numbers. This show has obtained a December 2020 email chain between senior CDC officials, Trey Moeller, a Donald Trump appointee, who was CDC's deputy chief of staff at the time. He emailed top officials to ask why COVID was listed as a cause of death for nearly 30,000 cases of sepsis, 784 HIV cases, many drug overdoses, and somebody struck by lightning. Those didn't seem like COVID deaths to him. But the officials defended the policy of marking these deaths as COVID deaths, even though that didn't make sense. Bob Anderson, head of the CDC's mortality statistics branch, responded this way. In many cases, these comorbidities would not be fatal on their own. Oh, the lightning strike, for example, right? Now, over a year later, and with Trump safely out of office, the CDC is publicly acknowledging, yeah, they lied.
I want to ask you about those encouraging headlines that we're talking about this morning, this new study showing just how well vaccines are working to prevent severe illness. Given that, is it time to start rethinking how we're living with this virus, that it's potentially here to stay?
The overwhelming number of deaths, over 75%, occurred in people who had at least 4 comorbidities. So really, these are people who were unwell to begin with.
And it's not just the feds. In the state of New York, the governor is acknowledging that nearly half of the state's hospitalized COVID patients were actually admitted for reasons that had nothing to do with COVID.
Looking at just on the 4th of January, we realized that 39% of the people are hospitalized with non-COVID related reasons. And checking in yesterday's number, that number was actually 42%. Now, that is our statewide average. But it's important to also look at the variations in our different parts of the state. The most number of people admitted for non-COVID reasons as of just yesterday, or a couple days ago, are in New York City. It's about 50-50. 50-50. So half of the hospitalizations in New York City are someone who needs to be there because of their COVID, severity of their COVID situation, and the other half are there for other reasons.
The other half are there for other reasons? It's been 2 years. This is not some esoteric number. This is not a footnote in a study. These are the hospitalization numbers. These are the most basic numbers that we have, the ones we talk about every day, the ones upon which all COVID policy is based. And it turns out they're completely wrong? Completely wrong. Liars. Dr. Scott Atlas is a former coronavirus advisor in the Trump White House. He's the author of A Plague Upon Our House, an amazing book on his experiences. He joins us tonight. Doctor, thanks so much for coming on. You were famously, we've had this conversation a number of times, stunned by how political the process was when you got a look at it firsthand. But even as cynical as you became from that experience, are you a little shocked to find out that half the hospitalizations in New York were not actually from COVID?
Well, no, because I knew that then. This is not news. This is just newly revealed. This is a continuation of the denial of science and the facts, the basic facts about COVID. We've already seen almost a year ago, even the medical literature, Stanford Pediatrics published a paper showing that more than half of pediatric hospitalizations for COVID had zero symptoms of COVID. Zero. This is in the medical literature. This was in the medical literature throughout the spring of 2021, except while I was in the White House in the summer, late summer, early fall 2020, we knew this because we were defining COVID differently on the basis of simply a positive test. And so there was a complicated system of reimbursements and other incentives, and these people were called COVID hospitalizations. When you have zero symptoms of a disease, that's not the reason, obviously, for being hospitalized. You just happen to be test positive. You know, this is always, again, a remembrance for me of how it was there. When I was talking about the risk factors to the task force, the people in the task force didn't understand, didn't know, or simply denied the facts. We know now it's 2/3 of deaths of Americans from COVID are people with 6 or more comorbidities. Yet the message was out there that anybody with hypertension, high blood pressure, was at high risk for COVID. That was false. We knew that. I showed the papers to the people on the task force back in the summer of 2020. By the way, they didn't just deny it or didn't know it. They simply said I was an outlier and kept repeating misinformation. So we have to remember, these people were not only, as you say, incompetent. I was stunned. There was a moral bankruptcy, a complete failure of public health leadership, which continues today because these people don't take it upon themselves to know the data and to say it truthfully. So instead, they have inculcated this culture of severe fear. And, you know, you should read about this in my book, but basically this was an intentional inculcation of fear in the American public. It was admitted to me in the task force room itself. This is really, this can never happen again. We cannot have public bureaucrats, public health bureaucrats be in charge and be deemed experts. The American people now are in a position where we have to know the data ourselves, figure out who's speaking truthfully on the basis of their consistency and showing facts, and then rely on them. We can never trust these kind of bureaucrats and people with credentials, again, simply based on their credentials alone.
Greatest crime in American history. Nothing comes close. And one correction, they didn't just describe you as an outlier. They tried to destroy your life for telling the truth. I watched it happen. So thank you for standing firm. Dr. Scott Atlas for us. Thank you.
I just want to have a shout out to my friend and colleague Johnny Anides at Stanford, who kept reassuring me during that time, Scott, the truth will prevail. Everything you're saying is exactly right. And hopefully we're starting to see that now with these admissions about hospitalizations and deaths being miscategorized.
I hope so.
Thank you.
No one else said it. Scott Atlas, thank you.